Tony is 61 and has cancer, but he doesn't know how far it's progressed. For that, he needs a biopsy. His doctor says he needs it and he wants it, but he's been waiting since August last year to have it. Almost 9 months of uncertainty.
And he said it would take about 3 weeks for me to get the appointment through at the hospital, and I'm still waiting for the appointment now. And what does go through your mind, with a man in my position, is that, what's happening inside your body? Where's the cancer spreading? What's it doing? Because obviously you have the effects of the cancer. It is painful in various places, etc. And it really does get into your head sometimes. Not all the time, but there are times when it really is quite overwhelming.
Boil this story down and it's about how the NHS provides new treatments, an issue which has certainly dominated that place in the last session. Tony needs something called a template biopsy. Now, it's relatively new, but demand for it is increasing. But his health board have told us that they have capacity issues around it. So they're looking at hospitals in the northwest of England to see if they have any space there to take on some of their patients and reduce the waiting list. Andy Thomas is a doctor who performs template biopsies in South Wales. He's also chair of Prostate Cymru.
We need more surgeons and more hospitals to be doing this procedure. I don't anticipate that every hospital needs to do it, but if there's one hospital in each region in Wales performing the technique, then that will kind of shorten diagnostic times.
The majority of men that do have prostate cancer are in the 70s, 80s and above. But if you've got somebody that's 80-year-old and they've been told you, oh yes, you're going to have a template biopsy, we'll get in touch with you. These guys are just sitting waiting. Most probably, a lot of them have most probably been waiting a lot longer than what I have. And the longer that they wait, the worse that it's getting. It doesn't get any better.
Betsy Cadwallader Health Board have apologised to Tony and say they are increasing training for more of its consultants to perform this biopsy. But tonight, Tony is still waiting for his 9 months and counting. Rob Osborne, ITV News.